Is there anything wrong with taking painkillers for general aches and pains? After treating a huge variety of patients with a variety of different tendencies towards painkillers, as an osteopath, this is what I think. And a quick disclaimer, this is not medical advice. This is just my perspective as an osteopath across a broad scope. Patients often struggle with the perspective of being in pain. They often kind of think, well, if there's just a simple choice between being in pain and not being in pain, then why would I be? However, it's vital to understand the pros and cons to different types of painkillers because they affect you in a multitude of ways. They affect your mental health, they can affect your systemic health, and they can also affect your musculoskeletal health through perception of injury. So understanding the risks and the rewards is a really important thing instead of just taking them without considering any of it. As an osteopath, I help people who are taking painkillers all the time. And because we're often considered an alternative to over-the-counter pain medication or prescription pain medication, it can be a difficult world to navigate, but I do have a personal perspective on it. And I do have some general rules which I'll outline to you today to just try and give you at least a foundation of, okay, painkillers are fine, and people like me, osteopaths, will typically support in a non-judgmental way people that want to take painkillers, but here's just a bit of a structure when considering whether these risks and rewards are actually worth moving forwards with. So first of all, I thought it'd be useful to give you a quick breakdown of how the painkillers that we typically see in the UK actually work. So we'll quickly categorize them now. So paracetamol, probably the most common one that we use in the UK. It works neurologically, so it's not an anti-inflammatory. It's very fast and very effective for mild to moderate pain, in particular headaches. It's very safe in low doses. It doesn't cause any stomach issues, but if you were to overdose on it, then the consequences for your liver are pretty catastrophic. And if you were to overuse it over a period of time, then there is some association with liver damage there as well. So non-steroidal anti-inflammatory drugs, we would call them NSAIDs. These are things like ibuprofen and naproxen. NSAIDs basically block the enzyme which produces inflammation. So as opposed to working neurologically like paracetamol, they're just working on the inflammatory process. Inflammation irritates nerves, puts pressure on nerves, and that's what can cause pain. So they are effective for mild to moderate pain, and they're also very effective in reducing inflammation and swelling, which is what a lot of people will use them for. However, they do come with risks to the gut lining, and a lot of people will know that they've got to take other medication if they're on an NSAID for a long period of time because of the risk to the gut. It's also worth considering that the inflammatory process is actually there for a reason. It's how we basically heal, and it's how that we get what we need to get to the area to resolve the problem. So just blocking the enzymes which produce inflammation can reduce pain, but actually you might hinder the recovery by negatively affecting that inflammatory process. It's also worth mentioning that we've got topical options for NSAIDs, things like Voltarol. They're not going to come with any risks to the stomach. So if you can't take a non-steroidal because of a stomach problem, you can still take a topical cream and put it on the area that's swollen and painful. And lastly then, we've got opioids, so things like tramadol, codeine and morphine. So these actually change the way your brain perceives the pain signal. It can come with a sense of euphoria and certainly can come with a sedatory effect on the patient as well. These are incredibly strong and incredibly effective for severe pain. However, like a lot of people know, the risks are that they are highly addictive. They can affect your sleep, they can create constipation, and because they create this sedentary effect as well, they're not safe often to drive on and things like that. So for general aches and pains, when we're talking about painkillers and talking about the risks and the rewards, most of the risks we've kind of outlined there. That's just a very brief overview. This isn't a full pharmacology video, but yeah, briefly, all of them come with some risks and aren't perfect for systemic health. But if we move aside from that and say, Okay, if we have decided that the risks that we have outlined there, systemically or to your mental health, are suitable when considering the reward, then how do these things actually affect the musculoskeletal system, and what are the risks and rewards there? That's the much more applicable part for the osteopath and for the person with general aches and pains. So to start with, you've got injury risk. Now, a lot of people will consider this because it's kind of just intuitive, isn't it? It's like, if I've got an injury and then I take a painkiller and now I can't feel my injury, am I likely to re-injure it? Am I more likely to re-injure it? And there's two ways of looking at it, really. And basically, it all depends on what the diagnosis is. Because if you've got general aches and pains, which isn't to do with tissue damage, then taking a painkiller will actually encourage you to get up on your feet, load bear or move the joint or engage the muscle, which has got something to do with the pain, and in my opinion will lead to a more positive outcome for you, because it's getting you to engage it and get blood into it. Blood flow in means clearing old stuff out, and that whole process really pushes a recovery forwards. So if you haven't actually got tissue damage, you've got a general ache and pain that might be to do with a little bit of wear and tear, something osteoarthritic, then actually we would say that taking a painkiller to reduce the pain to then get you to take those positive steps towards moving more could actually be a net benefit thing for you. The other way of looking at it is that if you have got an issue which is related to tissue damage, you've got an issue that is related to some sort of tear, some sort of potentially rupture to a tendon, something has been affected which needs time to heal. And if you then take painkillers for that, if we then circle back to the original question, which is your injury risk higher? Then absolutely it is higher if you just completely mask it with painkillers and then go out and try and push on a recovery actively. So if you are going to mask the pain that's to do with true tissue damage due to something traumatic happening, then you need to be super careful, because if you're someone who has a tendency to try and get back to exercise quite quickly, so whether you're in the gym or whether you're a runner or something like that, and you just think, okay, well, I'm just going to take this, reduce the pain, and then I can just crack on and get on with it, you are not going to get the correct signals back from that tissue, which is going to warn you that it's potentially being damaged further. And then once those painkillers wear off, you could find that actually you've really hurt it, or you could just predispose yourself to, as you're doing something, it just completely going again. So there is definitely a consideration there that you have to be thinking about. Another thing that I would be thinking about is skewed data. So as an osteopath, we're treating people and we're monitoring their improvement based on certain treatments that we do, whether that's manipulative therapy, whether that's soft tissue, whether it's exercise therapy, or just habit and lifestyle change. Whatever it is, we're trying to work out what it is that's making improvement on this person, basically so that we can then, increase the amount that we do that, or try and optimize that to the fullest potential. Now, so let's say that on a VAS score, so on a scale of 1 to 10, your pain is currently at a 7, okay? And you're taking painkillers. We don't really know where your baseline is for them when we intervene with one of those things that I just mentioned, treatment, exercise, lifestyle change, whatever it is. We don't really know what the impact of the treatment is when you're on the painkillers, truly, because you might just be masking something, and we could be doing something which actually makes it worse, but it's being masked, or we could be doing something which is non-effective, but it feels like it possibly is improving because you're not getting the right signals back. It just skews the data. So what I would say is that if you're involved in any kind of medical intervention, whether it's osteopathy or something like that, the sooner that you can get off, especially over-the-counter painkillers, if you don't really need to be on them, but they're just to kind of make you feel better, but not really affecting your ability to get up and walk and function, The sooner you can get off those, the better, because then we've got a baseline understanding. Where is this person starting from? And are they improving with the treatment? Because if you're improving, then it's highly indicative of a continued improvement. You know, if we do something, it made it a bit better, and then we continue to do that thing and it continues to improve, that is a really good indicator to carry on with that treatment plan, because the likely outcome is that we're going to resolve the problem. Painkillers, they skew that process, they make it difficult for us to be able to know what's working and what's not. So I would say that the sooner you can get off them for that reason, the better. One of the other things with painkillers that you want to really consider as well is, let's say that you're not getting any kind of medical intervention like osteopathy. Most people know intuitively that it's just masking the problem and not actually resolving it. And if you offer somebody the opportunity to resolve a problem, from my experience, 99% of the time they're going to say, yeah, like it seems stupid to not want to resolve this problem. Painkillers kind of give you the feeling like you've got that opportunity, like, oh, okay, well, if I do this, it makes it better. And people start to consider their problem to be their pain. Okay, so my problem is that it hurts. My solution is I stop it hurting. That's not a solution to a problem. That is a solution to a symptom. Pain is a symptom, it's not a problem. The problem is what's causing the pain. So you really want to be careful with this one and be thinking to yourself, am I in the habit of just masking the symptom, making myself feel better? And is that actually giving me the ability to ignore the problem? Because the problem could be progressing, in which case by the time you go and get some treatment, because the intensity of the problem has risen so much, it's actually much harder to unravel and resolve it. Or it could be building up to a point, you know, a breaking point, which then an acute injury occurs as a result of ignoring the problem building up. So painkillers just masking the symptom isn't a good thing if you've got something that's a bit more chronic. So my personal perspective, do I take painkillers? The answer pretty much fundamentally is no. However, I've never had a really serious injury, or at least in my adult life, that has meant that I would really need to be on long-term painkillers. So that is not a hero move from me at all. I haven't had anything that's required that. I used to take painkillers more in my adult life, mainly for things like hangovers and stuff like that, because they are incredibly effective for a post-night out headache, but I don't really drink that much anymore, never have hangovers, and therefore don't really have the need for it. So when things do arise, you know, I've had a bad shoulder. I've been rehabbing an injury from when I lost an arm wrestle. And the pain that I get in that shoulder isn't pleasant. It's not nice. And I kind of wish it would go away. But I just fundamentally believe that I need to know how much my shoulder hurts. I need to know what hurts it. I need to know if certain things used to hurt it and now they don't. It's all data and it's all stuff that I can use to try and continue to improve it if I want to avoid what some people would say is quite an inevitable surgery, but I don't want that. So we keep trying to rehab it and keep trying to move forwards. And the pain is data, it's feedback, and it's telling me what's going on with it. So no, personally, I don't take painkillers. I don't like when I see people that are highly reactive about their painkillers. I see too many patients who won't even find out if that slightly longer walk is going to cause pain because they take painkillers before the walk. And, you know, they're getting treatment, they're doing exercises, they're trying their best to resolve this problem, but they're still not willing just to find out, you know, the outcome of pushing things a little bit further. And that for me is a reactive place that people get into. Another thing that people do is as soon as they start to feel pain kicking in, then they instinctively take a painkiller to try and prevent it. But again, what if that hurt for 5 minutes slightly and then went away and then you didn't have pain? In your head, you've always prevented something that is probably worse than what it actually would have been or potentially would have been. So I don't like that reactivity. I like to be in my body, know what's going on with my body, and then I can make the correct decisions about how to manage my body. So yeah, my advice, where possible, and this is just where possible, regarding general aches and pains or injury rehab, is to embrace it. Look at it as something to focus on, not to run from. If you focus on your pain, it can actually start to reduce it as well, because you embody it in some way. The more that you fear it and the more that you try and get away from it, and painkillers is definitely a part of that process, then it's the boogeyman, it's chasing you around, and your perception of it is highly negative, versus just reminding yourself, okay, I've got pain. It doesn't necessarily equal damage. It just equals the result of something going on, whether it's a bit inflammatory at the time or whatever. Pain can be affected by so many different things, like our sleep and our mood, and what we've eaten. There are so many different factors. So I would say that it's much better to just lean into it, try and get more of an understanding of it. And I actually think that will help you to manage that entire process and get your head around it a bit better. So I hope that helps. Follow Body Zest and Luke Moves You for more helpful osteo tips.